So, Lauren, we're joined by a special guest who may have the record now for most appearances as a guest on this podcast.
This is true. So today we're joined by Rachel Meyer. So welcome, Rachel. Thanks for coming back.
Hello again.
So, Rachel, I thought maybe we'd start with the end of April and just talk a little bit about a congressional briefing that the American Kidney Fund organized on behalf of the community, and ASN had an opportunity to participate. And I guess I have two questions. One is to ask you what happened at the briefing and what your takeaway sort of messages were. Then the second thing is just to give us a sense as to the role these briefings play in our overall advocacy strategy.
Thanks, Todd. As you imply, the end of April was a big and exciting week for the entire kidney community. The American Kidney Fund pulled together a congressional briefing. And you may be wondering, what even is a congressional briefing? This is an opportunity for organizations, stakeholders to go to Capitol Hill and, together with congressional champions of an issue, invite the staff of offices, of relevant committees to come and learn about a topic that they may not be super familiar with. In this case, kidney diseases and kidney health 101, aided with an important incentive, namely tacos for lunch.
The tacos were a hit, I have to say.
The tacos were a hit.
Besides the tacos, what I think was really important and exciting about this briefing from the perspective of congressional staff is that it really demonstrated a highly unified kidney community. So in addition to the American Kidney Fund, other patient organizations, as well as health professional organizations, including ASN, represented by President Samir Parikh, participated, really giving congressional staff a sense that there is a strong degree of alignment in terms of what the kidney community's priorities are, as well as an ability to work together. And if you're a member of Congress or a congressional staffer, that's a really important takeaway message as you think about who you want to prioritize working with and advancing legislation in partnership with.
Thanks, Rachel. I had the privilege of attending the hearing as well, and I think the tacos were a huge hit with the congressional staffers, and the room is very full, which was great to see that many congressional staffers are interested in learning more about kidney disease. Can you talk more about who spoke at the briefing?
So, as Todd mentioned, the American Kidney Fund organized this, and it was ably moderated by their president and CEO, LaVarn Burton. She kicked it off by introducing Becky Schmidt, representing the Renal Physicians Association, who gave an exceptional 101 on what is kidney health and kidney diseases. I thought she did a particularly good job of emphasizing the preventable nature and silent nature of a lot of kidney diseases as they're progressing towards kidney failure, which, of course, from a congressional staff perspective, opens up an interesting set of policy opportunities to intervene earlier through things like screening and education. And happily, there is legislation in the works along those lines. Another one of the main areas of focus on Capitol Hill these days, from a kidney perspective, is doing a better job of supporting living donors. And I think there was no one better suited to address legislation to better support living donors than Miriam Godwin with the National Kidney Foundation, who herself is not only a fierce advocate, but a living donor. And she talked about the Living Donor Protection Act, as well as the recently introduced Expanding Support for Living Donors Act, both of which would enable us to support Americans who are giving the gift of life. We would be remiss if we didn't celebrate ASN President Samir Parikh, who followed Miriam Godwin and talked about the Transforming Kidney Health Research Report, an exciting outline of promising research opportunities in the kidney space that are currently underfunded. I think one of the most promising things about this report is not only does it have the support of more than 35 organizations in the kidney and transplant community, recently a bipartisan group of members of Congress co-signed a letter to appropriators encouraging robust funding to the tune of $1 billion with a B dollars to implement the Transforming Kidney Health Research Report's recommendations at the National Institutes of Health. So Dr. Parikh talked about the remarkable community unity that came together to outline this series of promising opportunities. That unity also helped to galvanize so many members of Congress in signaling their interest in having appropriators increase funding for kidney research. And rounding out the briefing, because you cannot forget the children, was Patty Mayer, representing the American Society of Pediatric Nephrology. And I think this is one of the really surprising takeaways for a lot of staffers is when you think about chronic disease, you typically think about it affecting an adult population who've had many years, if not decades, for this disease to silently progress. So you could see and sense a palpable dawning of recognition amongst the congressional staff that many children are born with congenital or genetic conditions that mean that their kidneys don't work properly and they may be facing dialysis or transplant early on in life. That's a difficult thing to learn. And I think a lot of members and their staffs left the room thinking, how can we invest in research, invest in better payment systems, and support innovation so that not only children, but adults alike can have a better experience living with kidney diseases, whether that's through prevention or treatments once they reach kidney failure.
Rachel, it's interesting because you mentioned the Wilson-Strickland letter to appropriators. And I wanted to emphasize that because to my knowledge, this is not usual that it would be a bipartisan letter making requests for such a large appropriations, as you said, $1 billion with a B for NIH focused on kidney research. I mean, I do think this is sort of a breakthrough moment. I do want to emphasize that point. The other sort of bipartisan letter that came not so much out of the briefing, although Samir did mention it in his remarks, as did other speakers, was the letter following the congressional hearing in March where ASN health policy scholar Suzanne Watnick spoke around the Officer of Kidney Health and Transplantation. I'm just wondering if you could provide an update on that effort as well.
We are in an unprecedented moment of bipartisan support for kidney health. That was recently epitomized, as you referenced, by a letter that House Ways and Means Health Subcommittee Chairman Vern Buchanan and Ranking Member Lloyd Doggett wrote together to Secretary Kennedy, encouraging him to implement an idea that Dr. Watnick testified about in the March 18th hearing, which is an HHS Officer of Kidney Health and Transplantation, an individual appointed at the level of the secretary who's tasked with waking up every day thinking about how to better coordinate kidney health across the myriad of agencies and departments within the Department of Health and Human Services that have a role to play in kidney health, research, or care. What's so remarkable about this bipartisan support is the rapidity and emphasis with which it came following the hearing. Neither Ranking Member Doggett nor Chairman Buchanan had ever even heard of this concept prior to March 18th. But I think Dr. Watnick and the other witnesses at the hearing were so forceful in their testimony about the need for better prevention, more innovation, greater investment in research, better therapies like home dialysis or transplantation, that they really drove home the message that resonated across the aisle about how having a single person focused on making sure that every agency is doing their part to improve outcomes for people with kidney health is not only a good idea, but an urgently needed one.
Rachel, it's interesting because one of the other things I think that's happened with the concept of the Officer of Kidney Health and Transplantation, and it's similar to what's happened with when we first started socializing the idea of Kidney X and before that, the Kidney Health Initiative, is each of these initiatives, and now I think also the Transforming Kidney Health Research Report, each of these are just sort of moments in time where the members of Congress, their staffs, the people in the regulatory agencies think differently about kidney diseases. They see the community coming together. And again, ACAF deserves a lot of credit for holding this briefing and helping us present sort of a unified front on all these different issues. But I think it also just raises awareness among policymakers about why kidney health is so important, why there needs to be a shift in focus from kidney failure to how do we screen for and prevent kidney diseases, how do we prevent the progression of kidney diseases, whole set of activities. I mentioned Kidney X, so maybe we can go there next in terms of an update on what's happening with Kidney X.
That's a perfect segue to another area that I think has really built momentum about the potential to do better on behalf of Americans with kidney diseases and those who care for them. In mid-April, the U.S. Department of Health and Human Services, together with us at ASN, unveiled the latest iteration of Kidney X prize competitions. Titled the Empower Prize, this particular competition focuses on soliciting ways, technologies, tools, interventions, behavioral support strategies, even institutional practices to better support living kidney donors. We know that these altruistic Americans, save the lives of their friends, family, and even unknown citizens on a daily basis. And yet our system really does not do a great job of helping them through that process and supporting them afterwards. We were thrilled that HHS Secretary Kennedy himself spoke out in support of this prize competition and the importance of helping Americans who are interested in becoming or have successfully donated a kidney to save the life of another. This huge spotlight on the opportunity to help more people access really the gold standard for kidney failure, living donor kidney transplantation, has sent current of electricity up and down Pennsylvania Avenue, furthering the momentum on Capitol Hill to better support living donors and really to understand other opportunities to improve our transplant system overall. In addition to unveiling this exciting prize competition, submissions closed June 15th, by the way, for any listeners who think that they or their institution might have a solution to submit for the $4 million prize, was a related announcement from the Department of Health and Human Services that they are committing through the Office of the National Coordinator for Health Information Technology to collaborate with ASN and the broader nephrology community to work on data standards and interoperability in nephrology and in kidney care. Advancing interoperability and doing away with the fax machine has long been a goal of ASN's, and we are thrilled that the administration has joined us in recognizing what an important problem the lack of interoperability is, but also what a solvable problem it is, working collaboratively with the entire kidney community, patients, health professional organizations, industry, EMR vendors, the transplant system, as well as relevant HHS agencies to develop a unified data dictionary and ontology so that we can really actually have interoperability and further research opportunities in terms of linking databases, collecting consistent information across studies, et cetera.
So this isn't an area that I've worked in very much. And I'm just sort of curious, who's opposed to interoperability? Like, where are the headwinds here?
I mean, I would venture to guess if you're a fax manufacturer, you probably
A paper record.
can.
I know some of them. Yeah. I
Yeah.
believe some of the Medicare
The
data
paper
is on
shredding
paper.
companies.
Yeah.
If you produce manila folders, maybe this is a blow to your industry. Apart from that, this is a almost universally supported goal, certainly in our community. And I think it's really exciting that the administration has joined us in recognizing that not only is now the moment is overdue. So we're excited to work with all the other stakeholders, as well as the administration over the summer to put our shoulder to the wheel and get rid of those manila folders and fax machines once and for all.
Maybe to just provide a little bit of a peek under the hood here in terms of how these types of advancements occur. How did the administration start thinking about, okay, we're going to have this Empower Prize, it's going to be focused on living donors, but simultaneously we want to use this opportunity when everyone's attention is on Kidney X to also talk about data standards and interoperability?
So I think what's important to understand that may not be obvious all the time outside of the Beltway is that the Department of Health and Human Services is staffed by remarkable civil servants as well as political appointees who went into this line of work because they are continually looking for opportunities to make a difference in the lives of the health of Americans nationwide. As we were working with these individuals at the Department of Health and Human Services to stand up the Kidney X Prize, one conversation led to another, and we found ourselves talking about, well, fax machines and manila folders being an impediment to delivering the right care to the right patient at the right time, as well as holding back research in the space. This organically led to a conversation with the folks at the Office of the National Coordinator, as well as in the immediate office of the Secretary, about how might we go about solving this problem? And of course, we landed on it has to involve every stakeholder in the kidney community, as well as the relevant HHS agencies. So on the one hand, it's a matter of being in conversation, which Kidney X provides great opportunities to do so, but also I think really recognizing and lifting up the folks at HHS, again, career civil servants as well as political appointees who are there to make a difference. And by listening to what we at ASN surface in terms of challenges as well as opportunities, we're able to collaborate and actually make that happen.
Yeah, it's interesting. I think as we close out, there's a theme that's emerging here, and it's sort of two separate but related communities. One is within the kidney community, all the different organizations, the ones that you mentioned that represent the health professionals like ASN, the Renal Physicians Association, the American Society of Pediatric Nephrology, the American Nephrology Nurses Association, and others. And then on the other hand, the patient organizations like the National Kidney Foundation, the American Kidney Fund, NephCure, you have these different organizations that the more they can work together and have, as you said, a united front, the more the community is going to be effective. So that's sort of one piece of this. Then there's this other piece, which is within the federal government, particularly the Department of Health and Human Services, you have all these different agencies and institutes and centers that are dealing with different pieces of kidney diseases, kidney failure, overall kidney health. And while we can work with them one-on-one, and a good example would be the Kidney Health Initiative, the partnership around the FDA, you also have to think across all these agencies and how to link that. And that's why the Officer of Kidney Health and Transplantation is so important. And if there's a way that we can somehow have everything aligned in terms of here's a set of policy priorities, here's what we as a community agree to, and then we can get bipartisan support first in Congress and then within the administration and sort of back and forth, we can actually get some significant things done despite the fact that not much else is happening in terms of the congressional agenda, the relationship between Congress and the president or Congress and the White House.
Todd, I think you summarized the tripartite recipe for success that we in the kidney community have all been utilizing in recent years. Identifying the challenges facing people with kidney diseases and their care teams. Do the homework to outline shovel-ready policy opportunities that will, in a targeted fashion, solve those challenges, and then implement them in a collaborative way. Collaborative in terms of the kidney and transplant community, and working collaboratively with policymakers and those in the regulatory agencies on a bipartisan basis. That's how we get it done.
Thanks, Rachel. I really want to emphasize to our listeners that it's been an incredible couple months here in the kidney health policy space, and I really want to go back and give a little bit of that credit to our colleague Suzanne Watnick and her Ways and Means testimony, where a lot of this is coming out of. And I'm really excited to see where we go in the future and continuing with this momentum.
Thank you for listening to this podcast by the American Society of Nephrology. I'm Todd Ibrahim, Chief Executive Officer and Executive Vice President of ASN. This podcast should not be used in any medical emergency or for the diagnosis or treatment of any medical condition. If you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment, please consult your doctor or another qualified healthcare professional. Views expressed on this podcast are those of the speakers and not necessarily those of the American Society of Nephrology. This podcast should not be used in any medical emergency or for the diagnosis or treatment of any medical condition. If you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment, please consult your doctor or another qualified healthcare professional.